So again, I'm so delighted to moderate this panel, and I'll let Caitlin Caspi off.
Hi, everyone. I'm delighted to be here today. I'll be talking about minimum wage as a social determinant of health in the context of a study we did called the Wages Study. Next slide, please. We see economic stability listed here as a social determinant of health in Healthy People 2030. It's a social determinant distinct from others like education, access, and neighborhood built environment. And there's a lot of dimensions to economic stability, but if we take just one of them, employment conditions, and more specifically job pay, we can identify a modifiable policy action, namely raising the minimum wage. And if we do that, that could translate into better access to health promoting resources. So for example, it can translate into better food security, more stable housing, and these things in turn can affect a broad range of health outcomes. And we do have evidence that raising the minimum wage can result in more favorable health outcomes. But there's been some contradictory findings with regard to the relationship between raising the minimum wage and the effect on weight-related outcomes like body mass index and fruit and vegetable intake. But it is reasonable to test this premise of whether raising minimum wage could result in better weight-related outcomes, given what we know about the strong SES gradient in these weight-related outcomes. Next slide, please. So to test this premise, we conducted a study to understand the effects of a minimum wage increase on health outcomes, with obesity as the primary outcome. And I want to note that as we're intervening on a social determinant of health, this study had the potential to affect other outcomes too, as well as to reduce racial ethnic disparities in health, given that it's addressing something upstream. So in the wages study, what we did was evaluate what happened following the Minneapolis minimum wage ordinance. This was an ordinance passed by the Minneapolis City Council in 2017. And what it did was raise the minimum wage to $15 an hour incrementally. And if you remember, this was part of the Fight for 15 movement, where we saw kind of a large surge in minimum wage increases at the local level and at the state level. And, you know, using our 2024 lenses, a raise to $15 an hour maybe doesn't seem so high, but, you know, given where the wage started, which was around $10 an hour in Minneapolis, this was a substantial increase. Next slide, please. So we expected that minimum wage was going to result in improved diet-related outcomes through several mechanisms. This was our conceptual model, and everything here was what we measured during our 5 study time points from 2018 to 2022. And these things were measured mostly with surveys, but we also collected some food receipts and an annual height and weight measure for each participant. Next slide, please. So for our evaluation, we recruited low-wage workers in Minneapolis, and we compared their outcomes with low-wage workers in a matched comparison city. So we chose Raleigh, North Carolina, because Raleigh has surprisingly similar demographics and had similar health trends to Minneapolis. And in addition, it made a good comparison city because Raleigh is located in North Carolina. North Carolina has state preemption preventing local jurisdictions from raising their minimum wage. So even if Raleigh was the type of city that would do that, it was prevented by state law from doing that. So we enrolled participants in 2018, collected baseline measures, and then did 4 subsequent measurements through 2022. And then did a difference in difference analysis of outcomes between workers in Minneapolis and Raleigh. Now, funded by a separate mechanism, this was an NIH-funded study, but we sought out additional funds to kind of answer some emerging questions that arose over the course of the study. We aimed to get some narrative accounts with qualitative interviews. So we conducted a set of interviews in 2019, and then also a set of interviews in 2022. Next slide, please. Excuse me. So to reorient people to the landscape in 2020, these pictures are from exactly 4 years ago in Minneapolis. So we're talking about the first week of June in 2020. And you can see, of course, evidence of the pandemic with the masks, and you can see, the effects on kind of food insecurity and food distribution evident. And then on the right, this picture reminds us of the changes in Minneapolis, which was really the epicenter of civil unrest following the murder of George Floyd in the summer of 2020. And what I'm hoping to sort of remind people is the unique time period when we were conducting this study. And really nearly everything that we were measuring was disrupted by these world events of 2020. Some of this was evident in both study sites in Minneapolis and Raleigh, and then some of it was really specific to the Minneapolis context. So that's something we need to remember when we're kind of thinking about the results and implications. Next slide, thanks. So I'm just going to present some of the highlights from our findings. We're in the middle of an ongoing analysis, but we do have kind of the main results looking at changes in mean wages, so that primary exposure variable, as well as body mass index and food insecurity. So in our analysis, we looked at changes between each of the time points. We looked at overall changes within each city, and then we did a difference in difference analysis. So what I'm showing you now are just the adjusted models. Next slide. So this is the change in mean hourly wage. These are adjusted for inflation and presented in 2022 dollars. So what we see here is that wages went up overall in Minneapolis and Raleigh, and there was actually no difference in between the two cities in the degree to which wages went up. So what does this mean? It looks like what we're seeing here is reflecting the broader labor market trends rather than the effects of the Minneapolis minimum wage ordinance. Otherwise, we wouldn't have expected to see such an increase in Raleigh. Next slide. Body mass index measures were really quite stable over the study period. There was no overall change in Minneapolis or in Raleigh, just an increase in Minneapolis during the first time frame. Next slide, please. We did, however, see a change in food insecurity. So food insecurity rates were really high at baseline. More than 70% of the sample was reporting food insecurity, and there was an overall decrease in both cities. It looks like food insecurity hit its low around 2021 in both cities, and this decrease favored Raleigh, so more of a decline in Raleigh. Do we think this is due to the Minneapolis minimum wage ordinance? Probably not. Putting this in context, we know that in 2021, that was a year when there was really a range of COVID-19 policy supports in place that could be affecting food insecurity directly. That included many changes to the SNAP program, including increased benefits. It included the expanded child tax credit. It included an eviction moratorium. So really an unprecedented combination of supports that likely influenced this outcome. Next slide, please. So in our qualitative work, it can shed a little bit more light on the experiences of participants and how they experience these policies. So in 2019, we did interviews with 112 households who had or had lost SNAP in 2019 in order to understand the interplay between SNAP and employment. And then again, in 2022, we did interviews with 40 households with children to understand kind of the emerging policy response to COVID supports and how that affected households' economic stability. And I would say the overarching message, there's a lot we learned from these interviews, but one clear message was that for these low-wage workers, they were really experiencing chronic financial hardship and chronic food insecurity much of the time, despite receiving these economic relief measures during the pandemic, and also despite the increase in wages that we saw in both cities. People cited rising inflation over the pandemic period, indicating that maybe the minimum wage increase was too little too late. So one participant said, like every time they increase minimum wage, then the cost of living goes up. And it was also difficult for people to draw a connection between a single policy and a specific named impact. People relied really on a patchwork of supports to make ends meet every month. Many considered their budgets as a whole with multiple monthly expenses that were kind of competing with one another. So even if they did get some support, it wasn't always adequate to pay the totality of their bills. So we had, a participant indicate you got food, but you can't cook if the lights are out. And then finally, people were really acutely aware that with these COVID-19 economic relief measures, they were just temporary and they could go away any day. They didn't provide, even if they helped, they didn't provide a true stability for people. One participant said they were holding our hand along the way, and then all of a sudden they pushed us down the hill and said, whoever makes it, and whoever doesn't, doesn't. Next slide, please. So just a few notes on future directions. Next slide. So I wanted to bring us back to the Getting to Equity framework by Dr. Kumanika that was brought up yesterday, where it lays out these 4 quadrants and of kind of social and economic areas of investment in order to equitably address obesity. And I think what it does is it gets us back to this broader approach and thinking how we can work across these different quadrants. Yes, and also work at the individual level and the community level across different dimensions. And so aligned with this picture, I just wanted to offer some thoughts about expanding our approach in thinking about economic stability programs based on what we heard from participants in the wages study. So first, while there's been a lot of emphasis on safety net programs, and for good reason, these are necessary programs, at the same time, simply having a safety net might not be enough to ensure adequate health. And so I'd be interested in thinking about the next step of looking at asset building programs, things that can really help to promote actual long-term stability and also reduce the racial wealth gap. We should also consider re-implementing and continuing to evaluate temporary programs that were promising. So an obvious example from the pandemic is the expanded child tax credit. We saw that implemented temporarily, but it could be made permanent by Congress. And then finally, we need to think about better coordination of supports for economic stability. So what happened during the pandemic, this layering of multiple economic relief measures was really unique. But I wouldn't say it was totally intentionally coordinated or sustained, but what would happen if we would take that approach? Next slide, please. So looking at kind of putting our research lens on this, my advice in kind of conducting this work is don't start a social or economic policy evaluation during a pandemic. But if you do, I do have some things that I think the field of obesity policy evaluation could use and would be prudent to include whether or not you're collecting data in a pandemic or not. Next slide. So I think we need better measures of social policy exposures, measures beyond self-report. So in the wages study, we got actual pay stubs, and that proved really critical. But we were finding that people were underreporting their exposure to some other pandemic supports that we wish we'd had better measures of. People couldn't always recognize whether or not they'd received the child tax credit, for example. So we need to verify and validate those, maybe using tax records or other methods. Next, we need to take opportunities to measure exposures to combinations of social policies. It's hard to isolate individual effects because sometimes participants don't experience these policies and these supports in isolation. And so in order to do that, it makes sense to use mixed methods approaches because this is going to allow us to get those narrative accounts when quantitative results don't demonstrate the expected effects, and as happened in our wages study. Next slide. Thanks so much to this incredible team across 3 research sites and to our funders. Thank you.
Thank you so much, Caitlin. What an excellent presentation. And I know the pandemic upended so many research efforts, so you should be applauded, your team should be applauded on pulling out lessons learned and completing the research. Thank you. And now I'm going to turn it over to Dolores.
Hi, sorry for that transition. Thank you for the invitation to be here today at this conference. It's very exciting. And I'm gonna be asking you to please move on my slides. So let's go to the next one now, please. I wanna start by acknowledging my team and funders. Next slide, please. As we talked about a few times during the conference, it has been almost 15 years since the IOM report Bridging the Evidence Gap in Obesity Prevention, a framework to inform decision-making. While the report was really long and complex, one of its main messages was that we needed to conduct comprehensive and systematic reviews of the evidence on strategies for obesity prevention. And for that, we needed to use a really ambitious systems approach, including historical, social, ecological, policy, and political economy factors. I really like this report, and I actually use it to teach some principles about evidence assessment and integration. However, it is difficult to make this approach concrete. We have some tools for sure, such as evidence gap maps, but yet we are, I feel, falling short of assessing the evidence that we need, even more importantly, because it's something that we could do faster, aggregating and summarizing what we already know. And it is essential, of course, that we are fair and rigorous in the way we assess evidence. I want to talk about two areas where I think it would be helpful to summarize what we know. First, we take for granted that social determinants, social context, matter for health and obesity in particular. More specifically, we have evidence that place-based social determinants of health, such as neighborhood factors, matter. But we need to know the strength of the evidence, the size of the effects, both overall and distributional effects, and possible mechanisms. We also have a sense that social policy can influence obesity, but we need to answer similar questions about the evidence we have. I have not systematically examined the evidence on either of these topics, and unlike many of you here, I'm not an expert in obesity. So what I will present are just some thoughts that hopefully can inform our discussion. Next, please. Racial and ethnic equities are very large and happen across all the issues we are talking about, as we've heard many times already. So using an equity-focused lens is not only a moral imperative, but an analytic requirement to make sense of the evidence and inform policy. Next, please. The 2010 IOM report showed a multi-level model of influences on obesity that we in public health readily recognize. Yet, the challenge is to mine the evidence on these factors in a way that is usable for informing policies and interventions. We heard yesterday from the keynote speakers that talked about systems approaches about how to integrate some of this evidence. However, we still need to look at these factors separately and see what we know. Evidence, as we all know here, is usually complicated to summarize. Again, quality, weight, gaps, for example, populations are not included, etc. So let's review just a couple of things to illustrate this complexity. One factor is here on this diagram in the upper left corner, community or neighborhood influences. And the other one, which we will talk about today, and Caitlin already did, is not even here explicitly, but I think we all think on this panel is very important, and that is social policy. Next, please. I want to talk about neighborhoods because it's an area I know about, so I understand the challenges of summarizing the evidence. Unlike when I started my career, and there is wide agreement today that neighborhood factors matter for health independently of individual level factors. We even have some strong causal evidence. But what about obesity specifically? Next, please. So let me start by showing you some data from an index our research team has developed, an index of child neighborhood opportunity that we define as the conditions and resources available in neighborhoods that matter for healthy child development. And this index, it's in its third iteration. We launched the COI 3.0 just a couple of months ago. It's available for all census tracts in the US at 73,000 neighborhoods. And it's very comprehensive of many different factors. We have a large community of users, and I'm going to be talking a little bit about that later as well. Next, please. Something really important about this index is that it allows us to make comparisons in terms of neighborhood environment for children across the entire US, also by race, ethnicity, and over time. Next, please. The index is comprehensive. It has 44 indicators under the health and environment domain and the environmental health subdomain here. We have some indicators that seem to have a direct connection to obesity. But I think we would all agree on this panel that the social and economic and education domains also have factors that matter, such as poverty and employment. Next, please. I don't have time to explain our technical approach, but essentially we convert all these indicators into z-scores, so they are on the same scale, and we aggregate them up to subdomains and then domains, and finally the index. And they don't have the same weight. Their weight is based on their association with 4 important outcomes. We can talk more about that later. Next, please. So one measure that we use that is helpful is child opportunity levels, and there are 5 of those. And what we do is that according to the child opportunity raw score, we rank all neighborhoods, 73,000 neighborhoods in the US, from the lowest to the highest child neighborhood opportunity. And then we group them into 5 groups, each containing about 20% of the US child population. The very low opportunity neighborhoods are those with the lowest level of opportunity. And then we have low, moderate, high, and very high. So you get a sense of what this index is doing. Please, next. One of the main reasons, if not the main reason we build the index, is to monitor inequities, racial and ethnic inequities, in particular in neighborhood environment for children. I could show you 25 slides at least with these inequities, but I'm just going to show a couple. If we look nationally across these 5 levels of from very low to very high opportunity, we see that white and Asian children are concentrated in high and very high opportunity neighborhoods. Next slide, please. If we look at Black, Hispanic, and Native American children, we see literally a mirror image. These kids are concentrated in very low and low opportunity neighborhoods. I don't have the slide with me, but believe me that when you adjust for family income and focus only on children that live in families under the poverty line, these racial inequities don't go away. So we have large inequities in neighborhood environment and also in obesity and other health outcomes. So the question, of course, is can we link inequities in obesity to inequities in neighborhood environment? So we will think so from just looking at some of these pictures, but let's look at some of the evidence that we have. Next, please. First, using the Child Opportunity Index and other indices of neighborhoods, we see strong associations between neighborhood environment and health. Here we see a paper that shows a strong correlation between neighborhood opportunity, the 5 levels, and child mortality and caregiver mortality. We have a large community of users, including researchers of the COI, and we now have about 130 peer review papers that show strong associations between the COI and child health. Next, please. One very simple illustration is the association between COI levels and health factors related to obesity, shown here. We obtain the health data, by the way, from the Places project. Next, please. There is a lot of complexity, though. One question that people ask is neighborhood opportunity related to sensitive developmental periods or length of exposure? So we have some papers like the one here that, using individual data linked to the COI, show important patterns across age and exposure. Children born in very low opportunity neighborhoods, so at birth they live in these neighborhoods, have a very different elevated trajectory of obesity through age 20 than children born in neighborhoods with higher opportunity. Next, please. We don't know the mechanisms. We know some about the mechanisms, but research on some specific factors show associations in the expected direction. For instance, more walkable neighborhoods are associated with better weight outcomes and thus with more favorable diabetes and hypertension outcomes. So yes, some of the research outlines and has tried to test some mechanisms. One of the questions, though, is do we need to know more about the mechanisms, or can we proceed with strong evidence of causal relations or even associations? Next, please. And the evidence only gets more complicated. As it is the case with other outcomes, neighborhood environment seems to work differently for boys and for girls in terms of obesity. The probability of obesity increases more steeply with age for girls than for boys in disadvantaged neighborhoods and also in working class neighborhoods. So a question here is, how do we incorporate these nuances, for example, differential effects by gender, into informing policies and interventions? Next, please. So one additional question is, are these just associations or are they causal effects? We actually have some causal evidence from the Moving to Opportunity demonstration that showed that women that receive a housing subsidy and were required to use that subsidy to get housing in low poverty neighborhoods over time show a lower prevalence of obesity and other related outcomes. So this is good news, and it's a good segue into the question of social policy. So next slide, please. Given the recognition of the importance of social determinants of health in the last 2 decades, we have seen an increasing body of research that examines the effects of social policies on health. I want to make a few points about policies to support low-income families. One way we can classify them is here on this slide. We have policies that are tied to work or employment, and policies that provide a social safety net for families, including families without earned income. Many of these policies don't have as an explicit goal to improve nutrition or obesity, so it's important to recognize that. I will not talk about the policies that do, such as SNAP, because that has been covered elsewhere. Of the policies that are not focused on nutrition, we can say that their main goals are to supplement income, reduce poverty, improve family and child well-being, and for those that are tied to work, to incentivize employment. Because these policies have multiple goals and many do not focus on nutrition outcomes, we would ideally want to have an evidence map or evidence gap map showing the direction and quality of the evidence across these social policies and across the multiple types of outcomes they may affect. We are not there yet, so this should go into our bucket of priorities for research synthesis. We do, however, have some evidence for some of these policies, and I want to look at 2 examples. Next, please. First, really quickly, to go back to the question of equity, when we think about analyzing the design and effects of social policies, we must take into account equity. I think that has been said already. Our team does this by applying an approach that we developed in 2014 called the Policy Equity Assessment. I don't have time to go into this now, but I will be happy to expand this discussion later. Thank you. Next, the CTC child tax credit and earned income tax credit are, along with SNAP, our most important anti-poverty programs. Our child poverty rate is about 12 to 13% per year. Without the CTC and EITC, it would be much higher, about 19 to 20%. And for a recent example, as Caitlin talked about, is the significant expansion of the child tax credit in 2021, which was associated with historical decline in child poverty, both overall and for subgroups. We also have evidence of effects on other outcomes. One of them is food security. We know from surveys that families use additional income to purchase food, housing, and other necessities. Next slide, please. And we also know that one of the novel aspects of the expansion, that is monthly payments in addition to a lump sum payment, were particularly helpful in reducing food insecurity for low-income families with children. So there are a couple of lessons here. First, not surprisingly, programs that reduce child poverty can improve food security. And second, the design of policy really matters. In the case of the CTC monthly payments, which help stabilize family income, also help increase food security. So we need to be specific about policy design. Another important design feature of the CTC expansion in 2021 was that it eliminated earnings requirements. This means that families without earned income could receive the credit. We know that this is a design element that especially helps Black and Hispanic and Native American families who are more likely to have no or very small earnings. Additionally, since employment was not required, parental time was not a competing factor, which is a possible side effect, as we will see in the next example. Next slide, please. Another key anti-poverty program is the Earned Income Tax Credit, or EITC, which, as the name indicates, is tied to employment. We have very strong research using quasi-experimental designs that the EITC has causal effects on improving parental and child health, education, employment, and child maltreatment outcomes. We also have some studies that show that expansion of the EITC may have been associated with an increase in childhood obesity. Here we can see competing effects of the program at play. These studies show that the increase in childhood obesity is mostly explained not by the increase in family income, but by the decrease in parental time spent with children. An increase in the EITC causes parents to increase employment, which has a number of positive effects, including reducing poverty. But more employment reduces time investments in children, including time spent on food purchases and preparation, as well as time supervising children, which may have a negative impact in terms of obesity. Next, please. This is why I said initially that we need evidence maps to assess multiple social policies across multiple outcomes, including nutrition and obesity. And then we need to think about how these policies interact with each other, for example, using microsimulation. My reading of the literature is that we are not there yet in terms of evaluating the effectiveness of social policies on nutrition outcomes and obesity. But again, I'm not an expert. You are the experts on obesity. So I look forward to the discussion that we will have next. Thank you very much.
Thank you so much, Dolores, for your thought-provoking presentation and the critical work using the Child Opportunity Index. Okay, up next, we're going to turn it to Carl.
Hi, everyone. Thank you for inviting me here.
Oops, you're muted.
Thank you. Thank you for inviting me to present at this webinar. A real honor to be here, and I love the opportunity to talk to a non-housing audience for a change. So I am the director of the Eviction Lab at Princeton University. We were founded by Professor Matthew Desmond with the goal of creating the first national database on eviction filings. And having done that, we've gone on to be sort of a clearinghouse for evictions data and evictions research. Next slide. So quick background on the housing crisis. As I'm sure you've all heard, rent prices continue to go up. And this is unfortunate because housing is the primary cost for most families. In fact, in 2021, the median renter household making less than $30,000 a year had only $380 left over at the end of the month after paying rent. Obviously, if you only have $380 left over at the end of the month, you are not able to save for an emergency, let alone spend on, food, healthcare, and things like that as much as you'd like to. Next slide. So, if that's all you have left over at the end of the month, you are one unexpected expense away from an eviction. That's why each year we see over 2.7 million unique renter households receiving an eviction filing. And it's important to state that the risk of an eviction is not distributed equally across the population. So first of all, you have to be a renter in order to be at risk for eviction. Most Americans own their own homes, but most low-income Americans rent. This is especially true for Black and Hispanic Americans. Next slide. And even within the renter population, there's evidence of pervasive racism in rental markets. So there about 18% of renters in the United States are Black. But with our data, we estimate that over 50% of evictions in the US are filed against Black renters. And I think it's really important to stress income does not explain this relationship. In fact, we can show that Black renter households earning $60,000 to $70,000 a year actually have a slightly higher eviction risk than white households earning around $20,000 to $30,000 a year. So once again, income does not explain the relationship between race and eviction risk. Next slide. There's one more risk factor worth emphasizing. That is the presence of children in the household. So about 1/3 of renter households have a child present, but over 50% of evicted households have a child present. In fact, the time in your life when you are most likely to experience an eviction is actually when you are a child. And the age group 0 to 5 is the single most represented group in evicted households. Next slide. So, I think that this risk profile should sound familiar to a lot of people on this webinar, right? Hunger and housing instability are both most common in households with children, especially households of color. And these crises are linked in large part because, families that spend the overwhelming amount of their income on rent simply have less money to spend on food. There are all sorts of health consequences that are downstream of the housing crisis. We can link evictions to poor physical and mental health among mothers and children. We can even link an eviction while pregnant to poor birth outcomes, including low-weight births and premature births. And in fact, we have another study where we linked eviction records to mortality records. And we can show that, well, one being housing cost burdened is associated with higher rates of mortality, right? The more of your income that you pay towards rent, the higher risk of mortality you experience. We can also show that being evicted has an even larger effect on expected mortality. So within like the 5-year period that we're looking at in this study, evicted households had a 40% higher chance of dying than otherwise similar households. So we have this joint crisis. It's quite severe. And we wanted to know if social safety net programs were up to the task of protecting households experiencing housing instability, especially acute housing instability, like an eviction. Could social safety net programs protect these families from experiencing hunger? So we wanted to look specifically at the SNAP program. Right? There's reason to think that the SNAP program might be up to this task. There are studies that show that SNAP is very responsive to job loss. In fact, it's the most responsive safety net program to job loss, right? So you lose your job, your income goes down, SNAP steps in to make up for a portion of that lost income. Now, a family that is receiving an eviction generally experiences a decrease in income, in the months leading up to that eviction. So by the same token, we were hoping that after an eviction, we would see a major spike in receipt of SNAP. On the other hand, there's reason to expect that we wouldn't see this responsiveness of SNAP. And that's because of the high level of administrative burdens that surround SNAP as well as other safety net programs in this country. So to sort of adjudicate this question, will SNAP receipt go up or down with eviction? We uploaded tens of millions of eviction records to a secure server at the United States Census Bureau. And this is where I mentioned that everything expressed in this presentation represents my views and not the views of the United States Census Bureau. But this allowed us to evaluate what happens to SNAP receipt in the 5 years on either end of a family experiencing an eviction. Next slide. And to cut to the chase, what we saw was a severe drop-off in SNAP usage following an eviction. If you're looking at this chart, we're following two cohorts here. A cohort of people who received an eviction filing without a judgment, that's the blue line, and a cohort of people who received an eviction filing with a judgment, that's the orange line. A judgment is when the judge issues a ruling saying that a tenant has to vacate the premises, in most cases. And what we see in the years leading up to the eviction event is a very stable rate of SNAP enrollment, right? We're hovering around that zero line. We see a slight uptick in SNAP receipt in the year leading up to an eviction, which makes sense. That those are families that are beginning to see their income deteriorate, and they turn to the SNAP program for help. But in the year following that eviction, we see a 5 percentage point drop off in SNAP receipt among those families that receive a judgment. And remarkably, we see SNAP enrollment deteriorate the further we get out from the eviction, so that overall we see around a 9 percentage point drop in SNAP receipt for evicted households. This is shocking and of course quite unfortunate, because we know objectively that material need for SNAP is higher in the years following an eviction. So what's going on here? Next slide. we partnered with the Bauer Research Group at the University of Michigan, led by Dr. Kate Bauer and her colleagues. And they were able to interview SNAP recipients in Michigan who had also experienced an eviction. And so they generated a lot of interview evidence to really explain what was going on behind these data. Next slide. One of the most common themes was simply trouble with recertification. So someone told us, I didn't know that it was time for me to recertify. So when they sent my mail, they sent it to my address that I had gotten evicted out of. But by the time I got the information, my case was pretty much closed already. I told the lady that I was homeless and I didn't have anywhere for me to receive any mail or anything like that. They were saying things about getting a PO box. So, of course, when you're evicted, your notice might go to the old address. You probably don't have a new permanent address yet, where you could have documents sent to. And anyway, the documents that you might need to recertify, they could have been thrown out during the move. They could be in a storage locker somewhere. Very hard to recertify. Next slide. But some people reported they didn't even bother recertifying because it's so hard to use SNAP benefits when you're homeless. If you're in a shelter or living in a car or on the streets. Someone reported to us, say you bought a whole box of ramen with your benefits and you tried to leave it in the shelter that you were in. Somebody would steal your stuff, so you couldn't do that. And then you couldn't buy produce because they wouldn't let you use the refrigerator. They destroy your stuff with your name on it or anything like that. But it's not just that it's hard to use SNAP when you're homeless. There are administrative rules that make SNAP less useful. So you are allowed to deduct your rent from your income when you are seeing if you qualify for SNAP. So by virtue of losing your housing, you can no longer deduce rent. That makes your income look higher from the perspective of the benefits office. So someone told us, they say if you're not paying rent, you don't need food stamps because you've got that money in your pocket. Say you're paying $13.50, which everybody probably is, and you're not paying that anymore. They say, oh, you don't need those food stamps. You've got an extra $13.50 in your pocket. And that's not the case. The case is I got evicted because I don't have the $13.50. Next slide. So there's a lot of complex rules just like that around the SNAP system. Someone told us, I think it's a lot of the system is not a cookie cutter system. 5 people can speak with and have a DHS assigned worker, but those 5 different workers will explain and follow procedure 5 different ways. And you really see this with the rules around cohabiting and doubling up, which is a very common occurrence after an eviction. Technically, there are allowed to be multiple SNAP households living at one mailing address, but a lot of people don't know that, and even a lot of caseworkers don't know that. So someone told us, if you're already getting food stamps and you let somebody else stay with you, if the state picks up on that address, when you start using that person's address, now they know that your family of 3 is staying with that other family of 3. There's a chance that both of you could be kicked off the SNAP rolls because of this address confusion. Next slide. And, unfortunately, your caseworker's interpretation of the law can often supersede the law itself. And this came up in every interview. It was all about caseworkers, right? Overworked caseworkers could misinterpret the rules. Someone told us, I don't know if the worker's caseload is too much or they have too many cases. Maybe they just need to hire more people so that workers could actually care about the people and what they're doing. Someone else said, caseworkers don't even want to advocate for you, it just feels like. And that doesn't feel good. You're already struggling. Next slide. And this leads to an overwhelming cynicism around the welfare state in general. As one victim of domestic violence reported to us, honestly, I never told DHS that I wasn't staying at my old address anymore because I didn't want my stamps to be cut off. So I didn't really disclose that information. If you don't disclose an address change, maybe you're not cut off from benefits immediately, but eventually the state is going to realize that they have incorrect information and you're going to lose those benefits, possibly for a long time. And so many people, so despite this being not a good strategy, many people reported not updating caseworkers about address changes. They feared jeopardizing their benefits. They feared jeopardizing their friends or family's benefits if they were staying with friends or family. And many feared that Child Protective Services would take away their children if Child Protective Services learned that a family was experiencing a spell of homelessness. Again, Child Protective Services isn't supposed to do that, but many people reported this fear. Skip 2 slides. This one, thank you. So, the big picture is we really need to address the cynicism that surrounds social safety net programs. We need to meet people where they are, which is often very different than sort of the idealized program recipient, right? The state would love it if every program recipient had a stable address and had stable household boundaries, right? You could say, this mother and her 2 children can be found at this address, for 365 days a year. That makes you legible to the state. But unfortunately, many people who are experiencing housing instability and many SNAP recipients don't look like that at all, right? They have severe address instability, and their households might not have clearly defined boundaries, right? Children can be in or out. Other family members or income earners can be in or out. So what's that person's address? What is their household income? These things are incredibly difficult to calculate. And I think that one of our interviewees said this to us, very succinctly. She said, once you don't have an address, you're considered non-existent as a citizen of the state you're in. And so that makes them take all of your benefits. So that is really the challenge that we have to face to make sure that people who have an acute need for SNAP and other programs are able to receive them. Thank you.
Thank you so much, Carl, for that deeply, deeply compelling presentation on the intersection of housing and hunger. And now we're going to turn to the discussion and Q&A, and I'm really excited because these have been outstanding presentations, and I think we're going to have a really great discussion. So first, I want to start with Carl. So it seems that the SNAP application and recertification process really devotes a lot of time to avoiding fraud. Now, how much of effort do you think is wasted in that, and how many people are losing access to SNAP because there's such a focus on fraud?
The churn rate on SNAP is incredibly high. Churn rate is being kicked off of the program for, I think, like around a month. I think I've seen estimates that's around 40% of people experience that. So we were putting, so much effort, both, on the individual, on the state to process all of this. And then we have this whole, nonprofit infrastructure set up to help people access benefits that they clearly qualify for, right? All these resources expended on making sure people don't get SNAP when they don't earn it. But I don't know. To me, that's not a concern. The benefits are not that large. If people are trying to get this, I think that they need it. And it just seems to be a counterproductive way to run the system.
Thank you. Okay, I'm going to turn next to Caitlin, related to the minimum wage. So from your study, do you think there's a minimum wage today that might make a real difference? Or do you think that it's really about asset building strategies that are more important?
That's a great question. So yeah, one thing I have been saying since we first conducted that first set of interviews in 2019, and we were hearing that this is just too little too late, is the first step is thinking about evaluating not just the minimum wage, but a living wage. There's a lot of great work now calculating kind of real cost of living estimates, what it costs to live in different areas of the US. It's always well above minimum wage. And so I would lump that in as a first step. I don't think it's as opposed to a safety net or as opposed to asset building policies, but kind of in addition, fair wages.
That's great. Thank you. And relatedly, the quotes in your presentation were all really compelling. And there was one about, the cost of living, like you get an increase in your minimum wage, but the cost of living just, wipes it out basically. So in your study in Raleigh versus Minneapolis, did they have comparable costs of living?
Yeah, and I think those cost of living increases we saw were kind of across the board nationally. And I did look into whether or not kind of there were regional differences in cost of living increases. It seems like they were pretty comparable. These increases peaked around like the summer of 2022 when we were still collecting our last round of data with these participants. So I don't think that accounts for it. There were some other kind of site-specific differences in the implementation of some of these COVID programs, but I think that cost of living issue is just something we heard across the board.
Yeah, and I think it really varies by geography, and I think it can also be reflected within different neighborhoods, across the landscapes of neighborhoods. So I'm going to turn next to Dolores with respect to, opportunities in neighborhoods. We know how important they are. And we know that when there are disadvantaged neighborhoods where we can intervene and we can improve them, how do we implement successful and effective strategies to improve those neighborhoods without pushing residents out with gentrification?
Sure. First, I would like to say that there are two ways that you could improve a neighborhood environment for children and families, right? One of them is by improving conditions in neighborhoods that we would call lower opportunity. And another one would be to help families move into neighborhoods that are higher opportunity, right? Obviously, the second option is much faster. We also have a lot of barriers to be able to do that. One of them is that our social policy doesn't really support that broadly. The Section 8 voucher is coupled with housing mobility programs in some places, but the funding for those is still very small. And of course, we also have discrimination in housing, lack of information, a number of barriers, including limited production of multifamily and low-income housing in areas that are higher opportunity, and that is by design, by zoning restrictions, right? So another question, of course, is how do we prevent gentrification? First of all, I want to say that I'm not an expert in gentrification, but I've actually read the literature with a lot of interest. And I think that we actually have a lot of strategies to contain that effect of gentrification, which is displacement, right? And one of the things that we can do is preserve affordable housing, right? Make sure that we preserve affordable housing. So we need affordable housing in areas that are already high opportunity, and we need to help families be able to access them. And I would call those strategies kind of desegregation or reducing concentration effects, strategies. And then we also need the flip side of that, which is areas that are getting better. We should be able to preserve affordable housing there or even build new affordable housing there.
Thank you. And I know, so schools are a critical part of neighborhoods as well. And that's one of the key pieces of the Child Opportunity Index as well. To what degree do you think inequitable school funding contributes to low education resources in neighborhoods?
Inequitable funding is for sure a factor, right? And we actually look into that just closely in terms of reviewing the evidence recently. But we have had a lot of school funding reform initiatives at state level, for example, right, trying to equalize funding. And so it is important to do that, but I think it's also important to try to think about the outcomes, right? So in terms of the language that we use in public health, it's not only equal funding, but equitable funding, right? We need to be able to acknowledge the level of need in different places, and that may require higher expenditures, and we have to meet those requirements. But in addition to that, I think that we also continue to see in the evidence that school segregation by income and also by race and ethnicity and by language continues to be a main barrier for kids to be able to access not only school resources, but also peer networks that can sustain their learning, right? So I think that we have to keep thinking about not only fiscal issues such as more equitable funding, but also very purposeful school desegregation strategies or integration, right? So people don't like the term desegregation because we associate it with things that people tend to be wary of, such as busing and things like that. But we have seen evidence about the effects of integration, right? And actually housing and school issues are very closely tied. There was this recent book by Kallenberg that talks about economic segregation as one of the main issues that drives inequality in schooling and education in the US. So we cannot think about housing policy without thinking about education. And of course, both of those things happen at the neighborhood level. That's why neighborhoods become so important for so many of the settings that we think about for health interventions in general, and in particular for obesity interventions.
I completely agree. And so I've been thinking a lot about, what kind of impact we could make if all children had access to really high quality education, in schools. And I know that there's a hot topic debate about private versus public education, but I was wondering if you have any thoughts on that.
Yeah, and these are my own thoughts. No, I mentioned my funders and my team in the beginning, so these are absolutely only my own opinions. I think that we have to be extremely careful with the issue of privatizing education, because what we have seen when we have tried to employ school vouchers to try to resolve the issue of limitations in public education, public schools, is that we have created even more inequality, right? And similarly with charter schools, although some of them are great and very well functioning, we have also created more inequities and more segregation in some instances. One example that I always talk about is that children with disabilities, for example, that have the right to public and education and in the least segregated environment possible, end up in many cases not being able to access charter schools, although they are being funded with public funds, right? So there are a lot of side effects of this movement towards vouchers and charters that we need to be very aware of. And I don't really know the evidence in terms of the food environment for kids in those different school settings. That would be important to think about for people that are attending this conference, but that's not my area of expertise.
Okay, thank you. Thank you. And now I'm going to pose a question to the panel, and it's not something that's really discussed, but I think it relates to housing, income, and neighborhoods and opportunity. So what role do you think discrimination in the legal system and unjust incarceration might play in health disparities in the wealth gap? And I'll start with Caitlin first.
Sure. So I think a substantial role, and I can think of a couple of mechanisms that we saw that potentially played out in the wages study. So certainly we saw people reporting incarceration as a hardship experienced by kind of a disproportionate or higher than expected proportion of the sample. And that is going to make it difficult for people to maintain steady employment. It's going to affect people being able to apply for jobs and maintain those jobs. And then also it can prevent people from getting these much needed benefits like SNAP or temporary assistance for needy families. So those ability to get and stay on benefits after incarceration, those policies vary by state, but certainly a potential mechanism for kind of the interplay of work and benefit receipt.
Thank you. Yeah, definitely agree. And Carl, do you have thoughts?
Something I'd like to emphasize for homeowners, when you're a homeowner, you can have whoever you want to stay with you, they can come stay with you, right? When you are a renter, in very many cases, landlords are able to write into the lease all of these restrictions on who can enter your unit, who can stay as an overnight guest. And very often, explicitly people with involvement in the criminal justice system, they will be restricted from being an overnight guest. Now, what this can do is, from the perspective of a renter, can put you in this really awful situation where, say, you have a friend, a family member returning from prison. They need a place to stay to get on their feet before they get their own job. You now have to choose between doing right by your kin, but that could put you at risk of losing your own housing, right? Do you choose your own housing, or do you choose helping out a person in a very difficult situation, that you're very close to, trying to reestablish themselves into society? So yeah, it's a major issue, and people decide this both ways, right? Some people do lose their housing because they tried to help out friends and family returning from prison, and other people don't, and that leads to people returning from prison having extended stays of homelessness and so forth. So yeah, and given the overlap of who experiences housing instability, who is likely to spend time in the justice system, These are very closely intertwined issues.
Yeah, thank you. I know there's increasing evidence to show that crime-free policies in housing have increased evictions, but not decreased crime. So I have many more questions, but I know we have limited time. And so there's a question that came in through the chat. Could folks comment on the interrelationship between time poverty and financial poverty? Dolores, do you want to take a crack at that first?
Yeah, I think that this is one of the things that I was trying to say towards the end, right? So we have a very strong emphasis in the US on tying anti-poverty programs to employment. And I think that we should have programs that do that, right? We also have programs that don't require the people work. And of course, we also need that kind of safety net. We need both. For the ones that require employment, obviously, then we enter into the territory of competing things, right? So people cannot get the benefit if they don't work, right? If they work, and they're also receiving the benefit, they tend to be better off in terms of economic resources. So they can probably buy more things for their children. At the same time, obviously, time is not infinite. So they are going to have less time to spend with their kids. And those time investments in kids can be as valuable as economic investments, right? And that's one of the reasons that people think that the EITC, some of the expansions, we have strong research designs that have shown that they may have linked to increases in things like obesity, because the family may have more income, but then the parents are not around to buy healthy food, to prepare food at home. There is more takeout, maybe less time to go out and play together, so on and so forth, right? So I think that that's why we need to look at the effects of these policies across a lot of different outcomes, right? And we as a society have to be able to answer what are the things that we value more. And so far, we have not valued parental time to spend with children in the same way that we value employment. That is a policy judgment, right? A policy value. And that's why I think that I'm actually like right now working on a committee that is looking at the tax credits. And I'm thinking about like some of the research that Caitlin described. I'm going to bring it to their attention, because I think that we have to be much more specific about the trade-offs, right? And yes, they are significant for families, and often we don't have a policy discussion about them.
I think that's a really great point. We have 1 minute left, so maybe with like 30 seconds, Caitlin, do you want to offer a thought?
I so appreciate Dolores's perspective. When I saw that question come through, I was thinking about just the trade-offs people make between their, their employment and their income and childcare, right? And just that competition and that tension that's always there, as well as issues around transportation, and how much time it takes to maintain a vehicle or figure out public transportation if you don't have access to a vehicle. And that is just another mechanism of the sort of interaction between time poverty and financial poverty.
It's so true. We're at time, so I want to thank all the speakers for their tremendous work. And it's just been such a joy and honor to moderate this panel and to speak with you all. And please keep up the good work. And I hope everyone joins me in thanking you so much for today. So thank you. Be well.
Thank you.